Most people don't talk about it. Many women hide it. Men panic when it happens, and almost no one understands what it truly means. Bleeding during intimacy. It's one of those moments that can instantly turn passion into fear, excitement into confusion, desire into worry. But what if I told you that bleeding, while unexpected, is not always dangerous, not always a sign of a problem, and not always something to be ashamed of? As someone who has lived inside the world of adult performance, who has seen both the fantasy and the reality of intimacy, I've learned this. Our bodies speak even when we don't, and sometimes they speak in ways we don't expect. In this video, I'm going to share the emotional truth, the physical explanations, and the deeply human experiences behind this sensitive topic. Not as a doctor, not as a performer, but as a woman who understands the rhythm of intimacy from the inside out. Let's dive into the part no one dares to talk about, but everyone deserves to understand. 1. The emotional shock behind that first drop of blood. When it happens, it hits fast. His breath changes, her heartbeat jumps. The atmosphere shifts instantly. Confusion replaces confidence. Passion is a fragile thing, and one sudden moment can freeze the room. As an adult star, I've witnessed this more times than most people realize. And here's what I always tell both men and women. Bleeding during intimacy is neither a tragedy nor a taboo. It is a message. And like every message, it needs to be understood, not feared. Some women feel embarrassed, some feel guilty. Some feel like they ruined the mood. But let me tell you something essential. A woman's body is not a machine. It is a living system with cycles, sensitivities, rhythms, and emotional triggers. This is where connection matters far more than performance. 2. What causes bleeding? The real reasons. No one explains clearly. Here are the common, non-dangerous reasons, explained through the lens of real intimacy, not medical textbooks. A. Cervical sensitivity. Some women naturally have a more sensitive cervix. Deep penetration, strong movements, or certain angles can cause light spotting. This is not a sign of injury, it's simply the cervix responding. B. Natural dryness. Even when desire is high, the body sometimes lags behind emotions. Stress, anxiety, hormonal fluctuations, or lack of warm-up can cause dryness, leading to microscopic tears. Here, the issue is not desire, it's preparation. C. Friction. Plus, intensity. When emotions peak, movements become passionate, fast, unrestrained. But intensity can cause the delicate skin of the vaginal lining to react. This is the part where passion must learn to coexist with awareness. D. The start or end of a cycle. Many women experience spotting when ovulating or right before their period. Sometimes intimacy simply accelerates what was already about to begin. E. Old scars or previous sensitivities. Childbirth, past injuries, or specific medical conditions can make the area more reactive. 3. The part no one talks about, emotional climax versus physical readiness. Now let's talk about the peak, but in a YouTube-safe, emotionally centered way. There is a moment in intimacy that women don't forget. A moment where her breath quickens, her chest rises sharply, her thoughts dissolve, her body leans into the sensation, her emotions overflow. This is emotional climax, the place where physical and mental desire meet. But here's the truth. Sometimes the emotional peak arrives before the physical body is fully ready. When the body hasn't fully expanded, softened, or matched the intensity of emotion, friction increases, and spotting becomes more likely. It's not pain, it's not danger. It's simply the body's way of saying, slow down, I'm with you, but I need a moment. And that moment, that pause, can become one of the most intimate parts of the experience. 4. How couples should respond. When bleeding happens, this is the moment that defines connection more than anything else. A. Don't panic, don't shame, don't blame. The calm reaction of the partner is everything. B. Pause, not because the moment is ruined, but because the body is talking. Touch her hand, breathe with her, let the atmosphere calm. C. Ask gently, are you okay? Not as a formality, as presence. D. If she's embarrassed, make space for comfort. A simple phrase like, it's okay, your body is perfect, we're fine. can save her from hours of self-blame. E. Continue only if she truly feels safe emotionally. Safety reignites desire faster than any technique. 5. When is bleeding not normal? Educational and safe. You should seek medical advice if bleeding is heavy pain, is sharp or persistent. Bleeding happens every single time there are signs of infection. She feels discomfort afterward. Light, occasional spotting is common. Strong, repeated bleeding is not. 7. Tips and advice for safe, connected intimacy. 1. Start slow. Let the body warm up naturally. 2. Focus on emotional connection. Closeness prepares the body better than speed. 3. Use lubrication when needed. Zero shame. It's smart, not weak. 4. Communicate without fear. Ask, how does this feel for you? What do you need right now? 5. Pay attention to her breathing. It tells you everything. 6. Pause when needed. It's part of the experience. Stopping is not losing the moment. Stopping protects the moment. 8. Final message. Bleeding during intimacy is not a flaw. It does not make a woman weak. It does not make a man responsible. It simply means the body is speaking. Real intimacy isn't about perfection. It's about presence. It's about awareness. It's about two people navigating passion together. And when couples understand the body, including its unexpected moments, their connection deepens in ways far beyond the physical. Next, video 7. Times a woman pretends she's fine, but she's not, emotionally or physically. A topic every couple needs to hear.